Yes. So share. Yeah. So Tamil, you can start now.
Yes, sir. Hi, good morning. My name is Thamizhenthi Ramachandra Das. I am one of the nurses in this medical clinic. Hi, Mr. Lingen. How are you feeling today?
I am fine, nurse, but I am little bit worried about this doctor. He asked me to meet you regarding this insulin injections. I don't know why he wants to change from medication regimen to insulin injections. Can you tell me what is the reason behind this?
Yes, Mr. Lingen, sure. So, till I have just before only I have reviewed your chart. You're a known case of type 2 diabetes. Your blood glucose level is moderately well managed by diet and oral medication till now. But the now recently your blood sugar level is a bit high. So that's why doctor wanted to suggested you to for a insulin injection. So that is the main reason. But today, by looking at you, you're feeling a bit anxious, right?
Yes, nurse, I am very anxious and worried because I am unsure about starting insulin injections. I have been managing for quite a while, for almost 2 years or 2.5 years, by my diabetes with medications and exercise and diet. Then why doctor asked, I don't understand. So I understand a little bit now. Tell me, please.
Yeah, I can understand your situation, and thank you so much for the question. Your body is not responding that much for the current management, so that's why doctor referred you to take a insulin, because insulin is helps to foster absorption into bloodstream, and as well as it's not broken down in stomach, and also it is a more effective than other method of management. So that is the main reason for the suggesting the self administration of insulin. And yeah, now I wanted to know about what is your opinion about the injection?
Okay, I earlier I was hesitating, but I can understand now. But the thing is, I don't really like the thought of injecting myself. I don't think I'll be able to do it because I'm scared of injections, right from my childhood.
Mm-hmm. Okay, so I can understand your question. The insulin injection is a very easy procedure. Today I'm here to help you. So if I'll explain the injection procedure, so is that okay to listen?
Yeah, of course, nurse.
Okay, thank you so much for the concern. The medic self in administration of insulin is a simple procedure. So before that, you need to follow the some instruction. So first foremost thing is you have to wash your hands and drying your hands with a towel. After that, you have to check the medication, like expiry date and everything, the dosage of the insulin. So with the prescription, you have to check everything. And also, and the third thing is you have to select the area. So once you have select the area, you have to pinch the skin, and after that withdraw the medicine, the which is required, which is mentioned in your prescription. So after that, insert the needle 45 to 90-degree angle, and slowly insert the medicine into the skin. So after that, don't rub on that area, because it will risk of your insulin absorption. So don't rub on that area. So leave the place 5 to 10 second, because it will preventing the formation of lump. So that's why leave the place 5 to 10 second. And also, next time when you will do the injection procedure, so you should rotate the injection site, so it will prevent the complication as well. So is that clear?
Yeah,
till
of course, nurse. I understand. That's very
okay.
clear. But the thing is, is there any other way to manage my diabetes other than this insulin injections? You think there is no other option?
No. So already I have explained the injection is a faster absorption into the bloodstream, and as well as definitely this injection, this method, injection method is will help to um, decrease your blood sugar level than other method. So that's why we insist you to take the insulin injection.
Yeah,
This
definitely.
is
Okay,
the
I'll
best
follow that
method.
one. I'll follow that one accordingly. And the thing is, I understand all the information is clear. Can you give me some suggestions and the procedure and in detail?
Yeah, definitely. So you should follow these steps of the procedure while you are doing the procedure. And one more thing I wanted to tell you. So after finish the procedure, you should maintain the safe needle disposal. It will prevent the needle prick injury. So after once you will finish the procedure, so you should dispose the needle into the suitable container, and also the proper handling the method also important. Once you will finish the procedure, recap the needle, so and dispose the disposable container, the syringe disposable container, because it will help to prevent the needle stick injury. So is that clear till now?
Yeah, that's very clear, nurse. And
Okay.
what will I do if this container is filled?
Yeah, once the container, that is the very good question. So once the container will fill, you have to dispose the proper bin, then needle syringe disposable bin. So we kept here. We will keep here. So you can dispose here itself. And also one more thing, the unopened vial you should put it in the refrigerator and not exposing to the sunlight or the high temperature. So always you will keep in the refrigerator. So is that okay?
Yeah, that's better. I really appreciate your suggestions. And yeah, I feel better about the injections now. And I'm ready for taking these injections.
Okay. Thank you so much for your readiness. So today I will be with you. So in front of me, you will your self administration of injection by yourself. So so it will help to prevent the fear and everything. So yeah, can we do?
Yeah, of course, nurse. Thank you very, very much.
Okay. Thank you.
Yeah. So here we are. Right. Pin. Yes. Now, first thing, yeah, Thamizhenthi, I really appreciate Tamil. You're doing fine. Earlier, it was a little, sad part that you did not perform very well, but now you have done well. Your confident level, first one, I think, yeah, I want to tell you is your confident level has increased dramatically or drastically. And yeah, that's fine. That's the best part of it. You have overcome that fear. Ne? Right, first time you are doing something, anybody will have fear, but that's gone out. Beginning itself, you have given a tremendous start. Next, you said other method of management. No, it's not other method, it's other methods of management. You have to say other methods. There are many other methods, so other methods of management, not other method. So if you say method, then it should be another method. Another method. If it is methods, okay, other methods. So what you did is you did not say another. So another method means it's okay, but another means only one is there, but there may be many other methods. So
Mm.
you have to say other methods, not not singular, it's plural. Then
Okay.
still the sounds are there here and there. Idea generation is excellent. You try to develop your concept, you one sentence after another, you organized it properly. The organization was excellent. Plot construction was fine, and you dealt on. You went ahead, yeah, and fast
Yes.
pace, and you handled every situation there. Then some doubts
Mm.
also, the questions also I asked you pleasantly and with a smile on your face. You have explained all these things. That's really good. And then there is one mistake. You said 5 to 10 second. 5 to 10 second. It's 5 to 10 seconds, plural, na? 5 seconds or
Yes.
10 seconds. How can you say 5 second? And that also
Mm.
after telling, then you repeated. You repeated the
Mm.
same thing again. 5 to 10 seconds, but not. You have to say 5 to 10 seconds, plural. But you said singular. 5 to 10 second.
Yes.
No. Then rotate the injection site. Rotate the injection site. Only one site is there. Rotate means you are rotating that site only. No, rotate the
Mm.
injection sites. So there are 5 sites. So one day
Mm.
here, one day here, one day here, one day here, and one day here, like that. So rotate the sites. If you say only one site, you rotate that one side, rotate one side. No, you are not rotating one side. There are 5 sides. You are rotating 5 sides. One, two, three, four, five. All together, you are rotating like this. You are not rotating one particular site. You understand?
Sir.
Rotate them one after another. That is the meaning. Not rotate it, but rotate all of them one after another. That's the meaning. So you made a mistake there. You said rotate the injection site. That means only one site is there. That site only you have to rotate. How can you rotate one site after another site then? No. So rotate the injection sites. There are 5 sites. You have to rotate them. So there is a clarity in my presentation. You see, there are
Mm.
5 sites for taking this injection. There are two upper arms, and then the two thighs inner area, and the area surrounding the umbilical cord. So these are the 5 locations. You should not repeat the injection on the very same site, but you have to do it in a rotational manner. Okay, in an orderly or organized manner, better clockwise. For example, right shoulder, then the right thigh, then the umbilical cord, then the left thigh, and then the left shoulder, like that. Okay,
Okay.
right?
Okay.
Clockwise order or something like that you can make, and then you have to make it in a diary so that you will not forget, okay, which side you have given when. So make it a standard. So if you make it in a diary, okay, injection diary, then it will be very clear. Every time you take an injection, you'll look into the diary, and then you'll feel sure that you are not taking the injection on the same site. So every site will be getting its turn once in 5 days or 5 times after fifth time, like that. So this will prevent the skin from bruising or itching or any sensation or anything like that. So that is how you're going to speak, expand. Is that clear now?
Yes, sir.
Yeah. Now it is your turn. So you can speak whatever you want. You give your feedback, how you improved from previous session to now, and what is the practice helping you in what way, and how are my suggestions beneficial for you, my feedback, everything you can speak.
Yeah, sir. The previous session, you told me to improve my confidence, and as well as the sometimes some area I will started to speak very fast. So this time, I gave some pause for the sometime like after and before, and
Mm.
as well as the content of the card content is very confident in this session. So definitely it will helpful for me to improve my session this session.
Okay, you are in the USA right now, right?
Yeah, yes, sir.
Which area?
Bellevue in Washington states.
Okay, Washington State, Bellevue. Okay, fine. What is the time now for you?
Right now 12.
So it is midnight, right?
Yeah, yes, sir.
So fine, fine. So you are comfortable. So whenever you are available like this, whatever time you are available, just message me. I can take a
Sure.
session like that. Okay. So
Sure,
fine.
sure.
If you are comfortable, you can have another session. Otherwise, you can call it a day and you can go and sleep, and we'll see tomorrow. Okay. Your wish. It's your choice. Because if nobody is
Okay.
there, I can take. That's not my problem. But if you are comfortable, then you can take. Otherwise, no worries. Okay. right?
Okay.
It is your
Okay.
decision. If you are interested, you can send a message on WhatsApp.
Okay.
Okay, right.
Okay.
That's fine. That's fine. Then next.